More to come, including the office blocks being turned into flats to help the capital's housing shortage, but at what cost? Staff shortages and poor quality care in A&E. That's the verdict on Northwick Park Hospital after an inspection by the health watchdog. The publication of the Care Quality Commission report comes ahead of next month's closure of 2 nearby A&E units. Critics claim this will put Northwick Park Hospital under even more pressure at a time when it's already failing patients. Alex Bushell reports.
No A&E can afford to fail, not least one that's being expanded as others nearby close. And yet today's report paints a picture of a department here at Northwick Park Hospital much in need of improvement, an assessment many share.
There are long waiting times, sometimes 4 hours, sometimes 5 hours. I think it's all about whether you're lucky you can get in quick. Staff were there available pretty quickly, and we were really very satisfied.
The service was appalling. The way the nurses treat you was appalling. Very disappointed in this hospital.
The Care Quality Commission found staff shortages across the trust, but singled out Northwick Park Hospital, saying it now needs to ensure there are enough staff in A&E, surgery and critical care, and better monitoring of the quality of that care. It also called for more appropriate equipment in paediatric services. The maternity unit was also rated inadequate for responsiveness, with women not always being able to summon the assistance they required. The timing of this CQC report is particularly sensitive. As of next month, the A&E units at Hammersmith and neighbouring central Middlesex hospitals will close as part of NHS reforms, placing this one under even more pressure. A concern I put to the Trust.
Plans later this year involve a significant investment and development in terms of a new A&E department on the Northwick Park site, some £20 million of investment. Again, we are confident as a board that that development will enhance and improve our ability to look after patients.
He points to how they've doubled the number of consultants in a year in A&E as one of the many measures to improve standards, but others remain unconvinced, including the leader of Ealing Council.
We were told very, very clearly by the Secretary of State that closures would not occur unless there were adequate alternative provision in place. Now, the CQC has said that the provision at Northwick Park is not acceptable and is not good enough. So we're saying halt the closure on the 10th of September.
In response, the Department of Health simply said in a statement today that these changes are now for the local NHS to implement, as are the promised improvements to Northwick Park Hospital. Alex Bushell, BBC London News.